everyone. I'm Yena from Wanna Be Taller team. So today we're with a patient who did limb shortening surgery. I know it's the first time that I just utter this. It's normally we have interview with limb lengthening patients, but right now we are going to do interview with limb shortening patient. So our patient is from the United States and we're going to ask her a couple of questions and she's going to answer for us. So first of all, how are you feeling?
Very good, actually. Surprisingly, better than I thought.
Better. Okay, perfect. So I have 6-7 questions, and my first question is, how has the process been for you so far?
So I guess immediately waking up from surgery, I had absolutely zero pain because of the painkillers.
Yeah.
And I really didn't have that much pain at all in the hospital either. Just when I first tried to stand up, I guess I had a little bit of pain.
Correct.
But yeah, I mean, it's actually been a lot easier than I thought. I guess the only thing was kind of just being able to handle not being able to walk it properly as I was before. But the pain level was a 3.
3?
Yes, but I don't know how it'd be for everybody else. But I didn't take one painkiller the whole time.
After you were discharged, right?
Yes. After the hospital, I didn't take any painkillers, but I guess it was more mental for me.
I remember you were preparing yourself for the worst.
Yeah, I definitely before I was this is gonna be the worst pain. I'm gonna be in agony. I'm gonna be having the worst pain ever. But so I think maybe that's why I'm it's not that bad.
I think you just kind of prepared yourself mentally. And in my opinion, the pain also is related to psychology. So if you are well prepared in terms of psychology, the pain becomes much more tolerable.
Yeah, and I had a really
for the limb lengthening patients as well.
Positive outlook the whole time just to get myself through it.
Yeah.
But it's definitely a hard process to go through.
It's intense.
It's intense. You really have to keep up with the physiotherapy and all of that.
But it's great. I talked with the physical therapist and they all told me she's doing great.
Yeah. Just have to really work hard every day. So.
Can you just explain briefly why did you have limb shortening surgery?
Growing up, I just always felt tall. I kind of grew faster than most people. I was 5'7" at 12 years old, or I guess that'd be 171 centimeters.
Roughly, yeah.
Yeah. So it was just always in my head that I was tall, and I mean it's a personal thing, but I just wanted to be 5'5" or 167 centimeters my whole life. That was just my ideal goal for that. So yeah, I feel I'm at my this is what I wanted. This height was my preferred height.
As long as you feel good.
Yeah.
I mean, that's all that matters. What kind of difficulties have you faced until now? I mean, you just told me that
during the
during the
definitely
recovery process.
Mental. Only during this has been 3 weeks so far, but I think it was the second week or the first week when I couldn't do certain things by myself. I get really frustrated, but I would work through it and figure out how to do it. Yeah, and it was I just would figure out how to do things.
You just managed somehow.
It really wasn't that bad, but it takes a certain type of person to be able to go through.
Definitely.
Type of thing.
Why did you decide to have the surgery in Turkiye with the new name Turkiye, or just Turkey as we know?
So one of the reasons was the price, obviously, and in America it would be $100,000 US. And I've been to Turkey before, so I love the country and I love the people, and I know how their hospitals operate and how hospitable they are. And in the US they wouldn't have taken care of you after the surgery.
After the surgery, it's you're all on your own.
You're just on your own, and they wouldn't have helped with physio. You'd have to do all that on your own. Because I didn't want to really tell my family that I was doing this, I needed some support afterwards.
The post-op care.
Yeah.
Are you planning to have limb shortening surgery for your lower legs?
No, I'm not. I feel my proportions are good now.
Right now it's good, you say. Okay.
And I wouldn't want to do that.
Okay.
That's it.
Can we learn the reason why you chose our team?
I mean, I just would rule out, or I'd look at all the different companies, and I just decided on this. I guess it was a combination of a bunch of different things. Definitely the team, and I just felt comfortable after I came to the consultation with you, and I really like Dr. Eunice.
Yeah.
because I felt like he was like a perfectionist kind of doctor, and I
He is
like
actually.
yeah, and I like that because like I don't want someone who just like doesn't care. Like he really wants to do his like
Yeah.
best job.
Correct.
So that's another reason. The price and like the support, like I said, like the aftercare.
Thank you. My final question is, do you have any advice for those who desire to go through limb shortening surgery? Any tips,
You really will not know what to expect until you do it. That's the
Definitely.
thing. But because like everybody has a different experience. But
Correct.
I guess just prepare yourself mentally as much as you can, because that's the biggest thing.
Yeah.
And set time aside from like all your other stuff. Like don't have stuff that you need to do while you're doing this process. Really take like 3 months to recover, and try not to stress yourself out, and just be patient and work as hard as you can to recover and gain all your muscle strength back. And the biggest thing for me is get up and walk a lot, and move your legs while you're in your bed, like after the surgery, or you'll lose your muscle if you just even take one day off. Like
It's just like keep them constantly active.
yeah,
Let's say, so that they will not forget their functionality.
yeah.
Otherwise, it'd be quite difficult to just like get back on your feet. I mean, for limb lengthening patients, we advise them to increase the flexibility. But for limb shortening patients, we advise them to lose some weight, especially for the thighs, because like the biggest complication can be the muscle imbalance.
Yeah, I definitely say like don't have like a ton of muscle before you do this.
Yeah.
Like just lay low. But I also did stretch a lot, and I think that
Yeah.
did help. So I do recommend stretching. But don't have a lot of muscle. Try and lose weight, and yeah, just move as much as you can after the surgery.
Thank you very much. Hopefully those who watch the video will benefit from it. Surely, especially like the ones who like have been considering to get limb reduction surgery. Like I'm sure like your ideas, your experience, your opinions will help them decide whether proceed or just like, okay, so I'm good. Like I don't have to just like do the surgery. So thank you one more time.
Thank you.
And bye-bye.
Bye.